It's what you're doing, making me feel like I'm falling. And when you're moving.
What's up, you guys, and welcome back to my channel. Today's video is going to be a little bit different than my normal videos, obviously. It's been a pretty long week in the Hickson household, but I did want to fill you guys in because I've talked to you guys a little bit about some health issues I've been dealing with recently, and a lot of you guys have been checking up on me or asking me if I figured anything out because you have similar symptoms or whatever, so I just wanted to kind of fill you guys in and let you guys know what's going on. First, let me say that I'm not a doctor, so do not take anything that I am saying as medical professional advice. If you have any of these symptoms, I'm not saying this is what you have. Definitely go see your doctor if you have any of these symptoms or you're concerned in any way. Like, don't take anything that I'm saying and apply it to yourself as if you have the same thing, because I don't know what you have. Just talk to your doctor. But to kind of fully explain to you guys what's going on, I have to take it back about a year. While Chad was deployed, the pandemic had just started. I was under high stress, high anxiety, and I started getting night sweats. And I'm talking like I wake up in the middle of the night, my entire bed is drenched, my clothes are soaking wet, and I'm freezing cold. My clothes are soaking wet though, to the point where when I wake up in the morning and I grab them off the floor next to my bed, because I now sleep with clothes next to my bed and a towel so that I can change in the middle of the night. But when I grab the clothes off the floor the next day, they're still wet. So that's how much sweat I'm soaking through everything when I'm sweating, okay? So I started getting those while he was gone, and I just assumed like, oh, it's anxiety, whatever. Also, I was getting them around my period too, so I figured it was like hormonal shift plus anxiety, right? Around the same time, I started dealing with like irritability, anxiety, like I said, and then like heart palpitations. But it was like a here and there kind of thing. I would feel like my heart was pounding out of my chest, but it would be like 2 beats every few days or so. It wasn't anything that I thought was serious. I also started experiencing insomnia while he was gone, which again, I just was like, oh, I'm dealing with all this anxiety, all this stress. He's still gone. I probably am just not able to sleep because I've got so much going on in my mind. So I didn't see a doctor because I just figured it was anxiety, and I just was living with it, you know? And some of these symptoms might be a little bit TMI for you guys, but I just want to kind of lay out everything for you so that you can better understand like what's going on in my head and what the doctors are saying and stuff like that. So around the same time, I started getting constipated all the time, and I figured, you know, it's just my diet. I'm not eating very well. It's just my diet, which it very well could be. I also, TMI, struggled with low libido. Is that how they say it? Like, I didn't want to do the deed. I had no desire to do the deed. Also around the same time is when I started getting Raynaud's phenomenon. If you guys follow me on Instagram, you know what I'm talking about, but essentially if I'm cold in any way, which is always, but my fingers and my toes turn white and almost like yellow because they're so white, and then after they warm up or whatever, then they turn blue/purple before they go back to like normal color. And this happens every single day. And when they're going back to their normal color, they burn like they're on fire. So I've been dealing with that since around the same time. I had like flare-ups of the Raynaud's thing like years ago, and then it kind of ended for a while, and about a year ago it came back, and with a vengeance. Like I mentioned, I am always cold, like regardless of what the temp is. I like to keep our house at like 72 because I'm always cold, and even at 72 I'm wrapped in a blanket, wearing a hoodie, wearing fuzzy socks, like bundled up because I'm always cold. I also have had this constant pressure in my head for the last year or so. I've gotten migraines for the last 8 to 9 years, but these are different. I don't know how to explain it other than like my migraines start here and they go around the side of my head and end here. My pressure headaches that I've been getting are just like my whole head just feels like it's full of pressure. I can push up here and relieve pressure, or here and relieve pressure, but it's just an all over pressure headache, almost like a caffeine headache. Like I used to get caffeine headaches, and I feel like they feel sort of similar, but I have plenty of caffeine and I'm like good in that area. So it's not a caffeine headache, but that's what it feels like. So those are my symptoms starting like a year ago. Those just progressed over the last year, and about 4 months ago, some new symptoms started occurring. I don't know if it's coincidence or not, but it did start happening right after I got over. I never fully like recovered from. I feel like when I was sick with, I was so tired and I just wanted to lay in bed the entire time. My body was just aching all over. It took so much energy just to walk to the fridge, and I feel like those symptoms never really went away. Obviously, I have a little bit more energy now, but it's not to the point of where I feel normal like I did before. where I was like able to function normally regardless of these weird symptoms that were happening that a lot of people deal with in their daily life. It wasn't anything like truly alarming other than the night sweats, but I had a reason for every symptom that I had. I don't like going to the doctor because I'm often invalidated when I go to the doctor, and so every symptom that I had this excuse in my mind of like why I'm feeling that symptom. So I put off going to the doctor for as long as I possibly could. But after, like I said, I started getting really fatigued and started getting a lot of brain fog. So what I mean by that is when I'm telling someone something, it's hard for me to think of like what I'm gonna say next or like what words I'm gonna say to complete the story. Like I'll be trying to tell my husband something and I'll just pause because my mind will not think of the word that I'm trying to say, but I know the word I'm trying to say, but my mind will not, like, I don't know how to explain it, you guys. Like my mind will not put the word through my mouth, but it's in my head. And then when that happens, I start getting frustrated with myself because I'm not able to get the words out. And then I just start overthinking it. And then I'm just like, never mind. And I just don't tell my story because it's just too hard for me to get the words out. Luckily, with video editing, I'm able to take as many pauses as I need to and cut out any pauses that I have to. But not only like finishing stories was an issue, but also I would do things like put the milk away in the pantry, or I would put face wash on my toothbrush and realize halfway through doing it, like, what am I doing? Or I put a huge metal bowl in our microwave and I started it, and like right away I pulled it. I was like, what am I doing? Like, I'm doing these things that are usually just like second nature. It's just like you just do it because it's normal and like your brain has already processed it, like this is what you do. You put toothpaste on your toothbrush. But it's like not normal for my brain anymore to just do those things without thinking about it. So I start to do it and then I'm like, oh, this doesn't make sense. And this probably doesn't even make sense. But I start to do it and I'm like, oh, this doesn't make sense. What am I doing? So I realize it, like as I'm doing it, I realize that it doesn't make sense what I'm doing. Around the same time, I also started struggling with balance. Like I would just be standing and all of a sudden start falling to one side and have to catch myself, which you guys know I'm a very active person. Like balance has never been an issue for me. I lift heavy things overhead and stay balanced perfectly fine. But in the last like 4 months or so, I've been extremely off balance. Something similar also happens when I stand up. So if I'm laying down and then I try to like get out of bed and try to stand up really fast, I will black out every single time. So I stand up and my vision immediately starts closing in with blackness until I can't see anything, and I just have to kind of stand by my bed or hold on to the wall until I come back to. Every single time that I stand up, that happens. I've also had a lot of shortness of breath. Like I said, I did have, so I wasn't super alarmed about that, but it got to the point and is to the point where my inhaler almost seems pointless at this point. So it doesn't feel like it's relieving me like it normally would. And also there have been a few occasions where I have this stabbing pain in my chest. So there was one day where I just stayed in bed all day because I was feeling so spent and I felt a little bit nauseous and I was just feeling off. And so I stayed in bed all day. I finally decided to get up and try to eat something to see if that would help make my stomach feel better. As soon as I took a bite of something, I got this stabbing pain in my chest. So I just laid back down, and then all day that day, every time I took a deep breath in, I would have this stabbing pain in my chest. So that's happened on a few occasions. So at this point, I'm kind of like, this is getting kind of sketchy, but I still don't want to go to a doctor and them tell me that I'm a hypochondriac. So I'm just going to ride it out and see what happens. Then about a month ago, I started getting more symptoms on top of all of the symptoms I already had. Those were continuing, and I started getting more symptoms to the point where Chad was like, go to the doctor. Like, you have to go to the doctor. So one day, Chad and I noticed that my nails looked different than his, and we were like, that's weird. I think my nails are just yellow from doing my makeup, so don't let that alarm you. But I don't know if you'll be able to tell in here, but basically there's this red line that goes across right here on each of my nails. And upon further investigation, we found out it's something called Terry's nails, which Dr. Google had nothing good to say about. So that was alarming. And then shortly after that, most of you guys know I've always had like incontinence issues where like it's stress incontinence. After I had my babies, if I'm working out or something, I will pee. But then it started happening to the point where I'm just sitting there and pee will start leaking out of me and I can't stop it, to the point where I'll put a picture up. So this is your trigger warning if you don't want to see a picture of my pee. But I was sitting down doing my makeup and I felt the pee start gushing out of me, and it soaked my makeup bench as well as my pants and my underwear and everything. Soaked everything. So that was a little alarming as well. It started happening it's happened probably like 6 or 7 times since then, which that was like a month and a half ago or so. So a little weird. I also have started hearing this like clicking sound in my ears. So I don't know how to explain it other than, you know, when your like eye twitches or something and it makes like a very fast movement like this, that's what it sounds like in my ear. Like it sounds like I have a muscle spasm going on inside of my ears. My resting heart rate has also significantly increased. My resting heart rate used to be like literally high 40s, which I haven't been working out since most of this started, which probably has a lot to do with my heart rate change. But the issue is every time I stand up, I get lightheaded. So my doctor thought that my blood pressure was dropping when I would stand up, but turns out it actually wasn't. My blood pressure actually rose when I stood up, and significantly, like hypertension stage 2 significantly, as well as my heart rate from laying down was 65 beats per minute. A minute later, stood up and it was 109 beats per minute. So my heart rate is just doing all sorts of crazy things. I also have my TMJ issue going on, so I can't open my mouth wider than that. I did have some dental work done a couple weeks ago, so I don't know if it's related to that, but it's been 2 weeks now and I still cannot open my mouth, so that's fun. I'm sure it's unrelated, but had to throw that in there. I also have this pressure in my ears, and it may be from my TMJ, but I feel like every time I open my mouth, it like pushes pressure out of my ears. I don't know, you guys, none of this makes sense together, and I realize that all of these symptoms they don't even work together, so it's weird, but just want to make sure I fill you guys in on everything, because if someone else out there is feeling similar symptoms and just kind of like brushing them off, I want to be able to help people recognize that some things you just should not push off. So the final symptom I talked about on my Instagram today, which I know it has something to do with the anxiety around all of this that's going on, but I woke up this morning. I'm not used to like feeling anxiety for no reason. So when I'm feeling really anxious, it's because of something, you know, like I'm anticipating a doctor's appointment or something along those lines where I feel anxious about it, or I have to call and order a pizza. I feel anxious in those moments. I've never felt anxious just because. And this morning when I woke up, I had this weird feeling throughout my whole body. The only way I can describe it is like butterflies in your stomach, but all over my body. So it was like almost like a tickly sensation all over my body, but it made me want to like crawl out of my skin. I was even nauseous at one point just because it's like that stomach drop feeling, but constantly. So yeah, that's the last symptom I'm going to talk about, but very uncomfortable. So I finally called the doctor after the Terry's nails and the pee thing happened, and originally the nurse or whoever it was that I talked to on the phone made me feel like a complete idiot. She said, okay, so she asked me to give her a rundown of my symptoms, and I just was like, okay, there's a lot of them. Like, do you just want like the general gist of things? And she's like, yeah, just the gist of it. I was like, okay. And so I just gave her a few of my biggest symptoms that I felt like were most concerning. And she says back to me, okay, it sounds like you're dealing with some anxiety, so I think that a therapist would be a great option for you, but let's have you come in and just chat with the doctor and see what she says. I'm like, so already going into this, I felt like they were not going to believe anything I was saying because they just think that I'm this like hypochondriac with anxiety that is looking for a reason to be sick or something, you know? So I go into the doctor with my list of symptoms, and I took a list of symptoms because I had been tracking the symptoms, trying to stay away from going to the doctor, but finally decided to go to the doctor when it became too much. So I took in my list of symptoms to hopefully help them realize that it's not just anxiety that I'm dealing with. Like, my issues go far beyond just anxiety. So I slapped my list of symptoms on the desk, and to my surprise, the doctor actually took me seriously. She was like, you know what, we'd rather be safe than sorry. Let's just run a bunch of tests and see what's going on. I was like, cool. So I go through my symptoms with her. She's going through the list and checking things off, and she knows that I've done my research and I know like what it could be, and I'm thinking like a vitamin deficiency or some type of like hormone imbalance, maybe my thyroid, something like that. So she's gonna like test for all that, and she's like, you know what this is leaning towards, right? And I was like, no. And she said it's leaning towards multiple sclerosis. And I was like, that's not something I ever considered, but okay. Upon my Google research, I never even considered that MS would be a possibility with the symptoms that I had. I genuinely just thought it was like a hormone imbalance or vitamin deficiency. So I was just asking for blood work to be done to figure out what kind of deficiency or imbalance I had. So she runs a bunch of tests and also orders an MRI and a chest x-ray. So with the labs, she just wanted to check like my blood count, my thyroid function, different vitamin deficiencies, stuff like that, which came back relatively normal. I had like a slightly elevated red blood count, and my MCH and MCV, not sure what that is, were low, but other than that, it was pretty normal. The only reason she wanted to do a chest x-ray was because I was having night sweats and I have latent tuberculosis, which I went through a 6-month treatment for in 2014 or something. I swear the weirdest stuff happens to me, like who gets latent tuberculosis? But she just wanted to make sure that it hadn't become active. So she wanted to do a chest x-ray, and obviously that came back clear and everything was fine. So after my MRI, I was like checking the computer like a psychopath. Maybe that makes me a hypochondriac, I don't know, but I definitely have medical induced anxiety now, and I'll go into that a little bit in a second. But I was checking my MRI results like over and over and over again, trying to figure out if anything had come back about the MS, because she seemed pretty set on my symptoms aligning with that. So I was checking, and then on Monday morning, something was finally in there, and I was like reading through it and figuring it's just gonna be like nothing, but just wanted to ease my mind a little bit before I went to my doctor's appointment on Tuesday. So I read it on Monday morning, and it said that I had a 3.3 millimeter arachnoid cyst in the posterior fascia, located just inferior into the right of the torcula hierophili. So I uploaded this earlier and then realized I had no clue what I was looking at. So I'm going to show you some pictures of my head again and tell you where I think that this golf ball might be. But I think it's right about here, pressing on the left side of my cerebellum and a little bit of the right, and then seeping into like where my skull meets my brain. I'm still not absolutely positive about that, but just based on what the doctor said in my own research, I think so, but I'll keep you guys updated for sure. Essentially, I have a cyst on my brain that is just slightly smaller than a golf ball. Or I guess if you're in the medical field, please don't come like correct me in the comments. Like, I don't know what these words mean, but I'm just telling you what the doctor has told me and everything else. So I guess the cyst is in the protective layer that goes between my skull and my brain, and it's pressing on my cerebellum, my brain, like the bottom part of my brain, in the back of my neck. Like I said, I was going in expecting them to be like, oh, you have this vitamin deficiency, or you have this hormone imbalance, or quit eating like shit. But they didn't. I know it sounds scary, but from what I've been reading, you know I've been doing my research. From what I've been reading, it sounds like it's in a good spot if they did need to drain it or remove it, and most cysts are benign. So hopefully we have nothing to worry about there either. I'm waiting for a call back from a neurologist or neurosurgeon about what our next steps are. But I am in a couple of like support groups on Facebook now because I wanted to talk to other people who had the same thing. And it sounds like neurologists are kind of split, and there's some controversy around removing them, leaving them there, draining them, keeping an eye on them, putting a shunt in them. Like, there's controversy around that, and there's controversy around whether neurologists believe that they actually cause symptoms or not. But there's a huge community of people within the United States or all around the world who are feeling the exact same symptoms that I had, and so they obviously cause symptoms, but it's a matter of the location, what kind of pressure it's putting on my brain, if the reward would outweigh the risk, that sort of thing. So I will definitely let you guys know when I know anything more from the neurosurgeon, but I have a feeling we've got a long road ahead. I've heard from many people in the support group that they've had to get second and third opinions before they were able to make the best decision for themselves on whether or not to keep an eye on it, or to drain it, or to shunt it, or to leave it. I mean, take it out, or what they were going to do about it. So regardless, Regardless, it's going to be a long road ahead, either living in pain or going through brain surgery. So I'll take neither for 500, but don't think that's an option. And can I just say, if you are a physician watching this, like, coming from a patient, like, listen to your patients. Like, I understand you have crazy people that come in, but we know our bodies and we know when something isn't right. So when we're invalidated in those feelings, that's why we have anxiety when we come to the doctor. Like, my blood pressure yesterday was 154/89, I think. Stage 2 hypertension, and I never have high blood pressure. My blood pressure is always like perfect or slightly on the low side. And I had stage 2 hypertension yesterday because I was at the doctor's office and I had so much anxiety around what they were gonna say, because I know that I'm never validated in my feelings when I go to the doctor's office. Even yesterday, my doctor was like, told me about the cyst, and then she was like, yeah, it's honestly, I've never seen one that big. I always see them around like 1 centimeter or whatever, but you can let the neurologist deal with that. What do you think about seeing a therapist? How's your anxiety medicine going? Should we up it? Like, just so focused on the anxiety aspect of it. And don't get me wrong, I will be treated for anxiety and depression if that's what my diagnosis is. I have no problem being treated for it. I will go see a therapist. I will talk about my issues. Like, I have no problem being treated for depression and anxiety if that's what the issue is. But are we just gonna like forget about the fact that I have a golf ball in my head? Or what? Like, if there's an underlying issue, I would rather treat the underlying issue that anxiety is the symptom of, rather than just treating the anxiety and forgetting about everything else that's going on with my body, you know? It's so frustrating. Like, I had breast lumps removed when I was like 12 or 13. I had breast lumps removed, and when my mom took me to the doctor was a complete asshole about it. Like, he did not listen to anything my mom was saying. I had these lumps in my boobs and he was trying to biopsy them through my skin and just being like a dick about it because he thought she was overreacting. Well, turned out I needed to get them removed and biopsied, and we could have avoided a whole lot if he would have just like listened to my mom from the get-go. Same thing happened with my gallbladder. Went into the emergency room, I want to say like 6 to 8 times before they finally listened to my mom when she mentioned on the very first time that I went that they needed to check my gallbladder because that runs in our family. They finally listened to her, and by that point my gallbladder was already collapsing on itself. Like, same thing with my appendix. I go to the ER because I have stomach pain, and they tell me that I really need to poop and that I'm just constipated. Next day they call me and say, oh, you need to come back in because your appendix is about to rupture and you need emergency surgery. Like, it's no wonder I'm a hypochondriac, and it's no wonder I have anxiety around going to the doctor, because nothing that I ever say to the doctor is heard. And every time that I've brought up a serious concern to the doctor, it is pushed away like it's nothing, and then it turns into like worst case scenario, like needing surgery ASAP. So it's a no wonder. Sorry guys, I went off on a little tangent there, but as you can see, it's extremely frustrating when you go to your doctor about what you feel like are serious concerns, and then they don't take you seriously, and then it turns out poorly. I've read far too many horror stories on the support pages that I'm on about people being told that it's not serious and to just keep an eye on it, and then things turn out not for the best. Also, the pictures of it are terrifying. So if you know someone who has a brain cyst, I would definitely be interested in speaking with anyone who's dealing with the same thing. There's not a lot of information about it out there because it typically only happens to kids, like you're born with it, or it's a result of some sort of like head trauma, which I don't know if I was born with it. The MRI that I had done in 2014 for my migraines is on its way to me right now, so we can kind of compare the two and see if it's grown or see if it was even there at that point. I don't remember them ever saying anything about it in 2014, but they could just have passed over it. I don't know. But children are normally born with it and then it gets worse over time, or it's a result of a head trauma, which I haven't had. So there's not a lot of information out there about adults having it, which is what I'm looking for, is another adult who's experiencing the same thing that I am, because obviously I like to Google. Anyways, you guys, that's my update. I will keep you guys posted if I know anything else from here on out, but all of these symptoms are still present, so I'm taking a lot of naps and extremely fatigued, but I'm trying to keep up, and I will continue pushing out content as much as I can, but just wanted to keep you guys in the loop. So thanks for watching, and I'll see you in my next video. Bye!
Making me